It's only entertainment.
Welcome back to The Talking Hedge. I'm Josh Kincaid, capital markets analyst and host of your Cannabis Business Podcast. Welcome back to The Green Rush, the business of cannabis. I'm your host, Josh Kincaid, with The Talking Hedge, Cannabis Business Podcast. We're on part two. We've got a great panel. We've got Sarah Chase, Executive Director for the Council of Federal Cannabis Regulation, and Michael Mays, CEO of Quantum 9. Panelists, thanks for being with us at Green Rush.
Thank you, Josh. It's great to be here. Hi, Michael.
How's it going, Sarah? It's nice to be included as well.
Yeah, appreciate you guys being here. Just jumping right in, I want to talk about. I think this one's going to be for Sarah, being regulations, and talk about social equity and how it relates, I guess, to the cannabis industry. We're seeing that psychedelics still illegal under the U.S. federal law, and keeping in with the long-time U.S. war on drugs. But we're seeing venture capitalists and investors, Silicon Valley tech bros, big pharma, all these players currently racing to pound down the doors of the perception into the realm of decriminalized the psychedelic industry.
Yep.
And we're seeing a lot of capital coming through, bringing that to a reality. But will the psychedelic industry follow the cannabis industry in trying to prioritize a social equity program for those most affected by the war on drugs, or will that not apply to psychedelics?
That's a very good question. Yeah, I think you're hitting the nail on the head here, because cannabis historically has a stigma with Black and brown people, and you have a very long history with the war on drugs. And it's created an environment where social equity and decriminalization and legalization of cannabis sort of do walk hand in hand. That's not quite the same with the psychedelic industry. Yes, there's a stigma around it, but I hate to use this term. It's sort of been the white person's drug of choice for a long time. So you don't have the same rates of incarceration. You don't have the same level of inequity that's been brought about because of this, and you don't necessarily have the same kind of legacy markets that grew up around this industry, because it's primarily a synthesized or a chemical version outside of the worlds of fungus and mushroom too. So you have something that's more of a lab synthetic, as opposed to sort of a plant that's been grown for thousands of years. So I don't think you're going to see the same approach to it that cannabis has had to take with social equity, just because of the history around it. It's that much more of a departure away. There is still going to be a stretch in terms of public understanding around destigmatizing this, though, and how are we going to approach the research around it? What needs to be done in terms of federal policy in order to make this a safe and efficacious approach to public health? I think that's probably going to be more of the push in terms of letting the research lead on this first and foremost, before the conversation about any kind of decriminalization comes in.
Michael, do you have anything to add to that?
Yeah, I think that, you mentioned that a lot of Silicon Valley money is pouring into the industry. And I think that much of that's fueled behind the FDA approach, getting these substances through clinical trials, actually determining what therapies and what ailments that they're going to address, and then going through the actual product life cycle of that. So I think that the parallels in cannabis, although from a regulation standpoint, how it's secured, how it's transported, how licensing is done, so many parallels on that level. But I think with taking more of a clinical therapies approach with psilocybin, with psychedelics in general, I think that will be the backbone of the industry.
Yeah, and I would like to build on that too, because that's a good point, Michael. The industry around psilocybin and psychedelics has more of a pharmaceutical approach and mindset to begin with, and I think that it will probably be slightly easier for them to tackle the tremendous effort needed to do clinical trial research, to the point that it's more more appropriate for the federal agencies to understand, and that will just sort of spur regulation a little bit faster, and probably legalization.
Yeah, on average, it's $500 million venture to get a product through clinical trials. I don't think a lot of people understand the lengths that you have to go to get there, but it is incredibly costly, and especially if you don't have government money coming into it. And private equity is one of your main solutions.
Right.
And money is really what's kind of making the world go round. A lot of people in cannabis has forgotten about Charlotte's Web and how the visual of seeing the girl Charlotte stopping with her seizures was one aspect, but really when the money came through, that's when everybody forgot about the girl and just realized that there was a lot of cash to be made, and they kind of forget about Charlotte. In the psychedelic industry, there's 1.8 billion that was raised from startups and public companies and private investors in 2021, and that was to fund research into the psychedelics. But those businesses still have to demonstrate that they have a viable business model. So experts fear that psychedelics will fall exclusively into the hands of big pharma, and the industry will follow the same path as cannabis, which is making the rich get richer. Will magic mushrooms give investors an experience of a lifetime, or just a bad trip? Michael?
Well, being a psilocybin investor myself, I've already started to look at publicly traded companies. Last year, the volatility was intense. I mean, you have companies like Compass, MindMend, Atai. These companies are amazing futures, but making that revenue model move faster is, kind of where the precipice is of, having a viable company and a viable product and where that meets. And I think that the long-term strategy is intellectual property. Like, how do you position to get an FDA product approved, and then that being the go-to therapy when other therapies don't work? So treatment-resistant patients that have tried other means and just can't get over that hump. There just needs to be, a few Charlottes of the world, whether it's psilocybin as a therapy or one of the other known psychedelic therapies. But I think that that's the exciting part. Is it only takes that one great story to really change perception of this drug.
Can I ask a follow-up question for you, Michael? Does the psychedelics industry, do they have the same difficulty that the cannabis industry has in terms of safe banking? Is that
so? Yeah. That's a great question. And if you look at where psilocybin is in the United States in general, federally it's still Schedule I narcotic. But like cannabis, there's states like Oregon that are just scratching the surface on state-run facilities, which it'll be more of a therapeutic experience where a licensed facilitator will consult with patients in a certain environment, using psilocybin as a therapy. And they just published the first round of rules. So, they'll be accepting applications in 2023, and is primarily where Quantum 9 focuses, is the licensing, and then, helping with the business planning, and then through that, then if there's any M&A activity there thereafter. But really, that's, the big scope of it.
Are they having issues getting their accounts shut down, like bank accounts?
Yeah, so there aren't a ton of companies that are doing this yet in the United States, other than the ones that, there's Canadian companies that are doing it, but it is a Schedule I narcotic, and they will face the almost identical banking issues. So where cannabis, avoided FDI insured banks, the only avenue there are local credit unions. So I think that that's going to be the tough part. But again, it was the bank's due diligence on, finding out what these companies did. And, if your focus and your website is more on the clinical trial end, it's going to be a lot harder for, a psilocybin company that's creating a therapeutic product to lose their bank account. It's not unheard of, but it's less likely than a bank account that says, pot shop kind of LLC,
And is the process with the DEA the same in terms of getting a license to utilize the product?
So in Oregon, they're not requiring DEA, a special license to do that. It's actually state run. So much like cannabis, where there's this disconnect between federal legalization and state legalization, you're starting to butt into that industry. So where this illicit market, which has been thriving over the last 2 years, is really starting to move into a more regulated market. So out of the black into the gray, just like cannabis. And soon, you're going to see, sweeping changes. We're one of 50 currently. So if you look at it from that standpoint, we're right at the precipice of the industry where, much like cannabis, it's the slate's blank. Insurance, banking, these things, we haven't even started brushing the surface on it. Once Oregon starts licensing these facilities, and there could be complaints and so forth, that's when the stories start to happen, and you start to lose bank accounts and these things for mainly irresponsible operators. But I think that the way that this is being set up in Oregon, it's going to be the opposite. They're taking every opportunity to make this a clinical product, and the backgrounds of the facilitators, the way these sites are set up, it's going to be a lot different.
Speaking of licenses, Kaya Holdings, they're seeking a license for the first ever state legal psilocybin manufacturing and facilitation service center in Oregon. What do you think is going to be the potential price tag by comparison to cannabis counterparts? We've seen limited licenses in like Arizona go for $20 million per location. What do you think is going to be the financial price tag of a license in the psychedelic industry?
Yeah, that's a great question. And it really depends on the model, right? Some of these companies that if it was license only, the way they're getting those huge, 10, 20, 30, $60 million price tags is the scarcity of licenses. So in a state like Oregon, where there is no cap on the number of licenses, that's where the valuations start to drop a little bit. Then what's the other end of it? If it's not just the license, it's the other side of it, which is the revenue generation or the intellectual property that's created. So an FDA approved product versus a product that's, state-based, that hasn't gone through all clinical trials, what has stronger IP? Obviously, long-term, the FDA approved product could, but in the short term, branded products seem to have a higher revenue stream immediately. So I guess that is the question. For me, I believe that it could be worth, day one license could be worth anywhere from 1 to 10 million, depending on, what license types that you have, and if you are vertically integrated with all of the different types.
And are social equity are considerations in part of the licensing for this market too, or no?
So, social equity is tough, right? Because, at what time have things become legal is the real focus. And, how do we affect those that have been negatively affected or disproportionately affected by the drug, the war on drugs? So where you don't have, like you were saying earlier, we don't have an overwhelming number of people that are incarcerated for psilocybin. What is the actual impact of providing social justice? There will more likely be regulations that allow those that have minor possessions in the future, have those in a more recreational setting. Although there's aspects of this in this industry already. Is it going to be a huge focus? Maybe, but more likely less than you would
think. Sarah, I got a question for you about the regulation. I'm in Seattle. So Washington psilocybin bill would legalize supported adult use. The passage of the act would enable the Washington Department of Health to issue licenses to psilocybin manufacturing facilities, testing labs, service centers, and facilitators, and create the Washington Psilocybin Advisory Board to advise the department in creating rules for the act's implementation. There's a growing number of states that are considering bills to expand research and access to psilocybin. How could magic mushrooms follow in the footsteps of cannabis regulation, Sarah?
Well, I think we'd have to think about everything from age limits to packaging and labeling, and to sort of go down each of those pathways. And then you would be looking about, what about infusions into food and beverage? What would be the restrictions there? Sort of like guiding the regulators on what are the unintended consequences and how can we address them preemptively. And I think that's what is informative about the cannabis industry, is all the questions that have to be asked around these products. And again, also impaired driving, public service campaigns about appropriate dosing. What is, my understanding of the psychedelic market too is a lot of the if you're not talking about microdosing, if you're having a trip or you're going through a guided meditation that's meant and intended to be therapeutic in its value, oftentimes that requires a guide or somebody who can kind of walk you through the experience. So I think, looking at this from both the public health and safety realm as to you don't want bad products proliferating on the market, how can you regulate that? All the way up to, what is the intended medicinal purpose of this, and how can you regulate appropriately for people who are seeking this both for medicine or for therapy?
It seems like they're going to be doing similar, kind of following the footsteps of cannabis with the distance from churches and schools and things of that nature. Michael, you kind of seeing the layout being basically just carbon copied from cannabis into the psychedelic world?
Yeah, I mean, before cannabis was, all of the regulations for cannabis borrowed a lot of regulations from the security industry for casinos. So, like you saw this in Colorado when they were at the forefront of the industry. Where else can we borrow regulations from? Who wants to start from scratch? Nobody. So, yes, there's going to be tons of overlap with how things, seed to sale tracking, inventory tracking, security, transport, environment. Those are all so very common, and Oregon's taking a lot of things from cannabis. But why not? This is the model is already set up for something in which there are public health issue concerns with adverse events. In the psilocybin industry, there's a term called set and setting. Your mindset going into an event, a therapy, and then the setting that you're doing it in. So where Sarah was mentioning, a shaman or a guided meditation individual, like that, I think is what is now required and will be the standard on how these medicines are delivered. But, that framework is, really starting, I believe, in Oregon currently, which will then set the stage for Washington, probably Colorado. I've seen some stuff in Missouri, Connecticut. Like they're all following similar paths. But the facilitator model that has a certain background experience, I think, is one that will stick.
Michael, have you heard the term psychopharmacology too, with people who are sort of combining? It's sort of a burgeoning field for pharmacists to get into, where they start to prescribe, what would be THC or psilocybin or anything that's along the line of a psychoactive. And I'm wondering, do you see a world? I'll give you two scenarios, and this is just a hypothetical, like one world where you would go to CVS and you would have both your regular pharmacist and your psychopharmacologist, who you could ask questions about. Well, what should I be taking for a microdose? Should I have X percentage of THC and CBD for whatever? Or do you see more of a world where you have dispensaries with people who are trained to a certain degree in pharmacology, but it's not necessarily a medical requirement?
Yeah, that's a great question. And pieces of that already exist, believe it or not. They're compound pharmacists. Before, you're seeing trials now with ketamine. Prior, they were already using it in some settings. So I don't think that it's going to be a la carte type of menu, like, hey, I as a compound pharmacist say, a little bit of this, a little bit of that. I think it'll be more so there needs to be a clinician that is involved from start to finish so that the adverse event cycle doesn't start. And if it does, having a nurse or somebody on site that can help that individual come out of their adverse event and into an environment where they feel safe again. Because at the end of the day, panic attacks, adverse events like that, high blood pressure, these things are not uncommon in the illicit market. So you can only imagine that in a regulated market, this could be something that may be of an issue. But again, it depends on the patient. What experience are they trying to derive? What therapy are they trying to get to? Is it like a microdose scenario, or are they really trying to break through? And that breakthrough is sometimes, it's a journey to get there.
I saw an article that said the DEA backs down and will not criminalize 5 psychedelics. So that's kind of where we're at. And where it started was a 2004 pilot study from the University of California in LA exploring the potential of psilocybin treatment in patients with advanced stage cancer, managed to reignite interest and specifically renew efforts in psilocybin research, heralding a new age and exploration for psychedelic therapy. You have universities that want the neuropharmaceutical market, and Wall Street wants it. But how much of the influence does Wall Street's capital have and lobbying on the industry, as you're seeing biotech firms funded by venture capital, buoyed by promise research to treat a variety of mental health issues? And is that a good thing? Sarah?
That's a complicated question. I would think that overall, the creation of a new marketplace like this is a genuinely good thing. And I think driven by an intention to do quite a bit of good for people who are suffering from anxiety, PTSD, any type of psychological issue that could be solved through new and alternative therapies. And that can go along with cognitive behavioral therapy, yoga, all sorts of things kind of combined. So I think the shift in the marketplace is clear to me. And it is one of those situations where entrepreneurs and investors will kind of lead the charge. Wall Street will follow, and then it will be a slow pace, but you will see the regulators and the administrations begin to follow, sort of follow the money as it can be proved. And I think a lot of this is going to fall to the research side of this to make sure that safety, efficacy is proved, and that the research is good. We say it at CFCR that good science leads to good policy. And I think if you really are following the science on this, and you see what the potential is, and what the opportunities are, then you've got a win-win situation for both helping with mental health crisis, helping people through very serious psychological impairment, and helping them kind of lead better, more productive lives. That in turn will inform how we regulate around this, to inform good policy.
Michael, do you think that there's a chance that this industry could go Schedule 2? The cannabis industry is really worried about pharmaceutical industry, big pharma getting 100% control of cannabis. Is it more likely that could happen with the psychedelic industry?
So, you use the term big pharma a few times, and I'm wondering if what your definition of that. Do you consider like a Compass or a MindMed? Do you consider that big pharma, or are you talking about like the DuPonts of the world? Where in that do you consider that? I guess is my first question.
Yeah, and Josh, I'd add to that. I mean, I think a concern with the cannabis industry, even before you get to the big pharma, is the MSOs too. There's sort of like a whole bunch of tiers here that we have to work through.
Yeah, I'll let you answer that question, and I'll.
Yeah, and I think I can answer both of those. I would consider MSOs and MindMed is like this middle stage, and so you have big pharma as like the top capital, and you have these players who want to become big pharma, and they've completely built out their entire advisory board to be like Tilray, for example. They want to be bought by big alcohol, big tobacco, big timber. They don't care. They want to be bought by somebody large, and that's why they're just a mediocre company. So when you look at big pharma, I'm talking about the big DuPonts of the world, Pfizer.
Yeah. So I feel like the cannabis industry has got a taste of that. And as a result, it's shifted a little bit. So if you look at canopy growth and how Constellation, Big Liquor, started to make big moves in there, and they really got bit hard from it. So do I think big tobacco, big liquor, will that be the consumer of all of these types of companies? Probably not. I think these MSOs are really going to be the ones that are gobbling up all these companies because they already have the model. They already know what they're doing. So for a larger company to come in and, take over everything, it's probably less likely than a middle-sized player becoming a large player and then becoming an even larger player. So now you have these giant MSOs that are merging and being, a larger conglomerate. So I think that the big pharma play is probably going to be more towards the FDA clinical proven through clinical trials companies, whereas your Oregon-based companies that are at the front lines with treating patients with facilitators, I think that in its own ecosystem will grow like the MSOs did in cannabis.
Yeah, and I'd add to that too that I think going back to this sort of psychopharmacology, I think you may see some very unique, very large companies that become the size of big pharma, big tobacco, and alcohol that just grow out of this new industry too. So you're actually going to have what is big psychopharma companies essentially that will grow out of it. You'll have a whole new division here that we can worry about.
Yeah, I mean, the thing about the companies that are practicing in this space already, I mean, they're not just limiting it to psilocybin, MDMA, LSD. I mean, all of these are, going through clinical trials now, and it's an exciting time because, before LSD was, criminalized and, it was a therapy for many people. And the experiences people were having, the breakthroughs that people were having, it was just, for lack of a better word, incredible. So I think that we can probably get there again. It's just that, how do we change public perception in a positive way while allowing these therapies to mature in a responsible setting with responsible operators?
Yeah. We all need to figure out who Michael Pollan's investing in.
Peter Thiel invested in, I believe it was a tie. So if you follow that money, I think it was
Speaking
a couple
of
of years ago.
money, I'm curious about lobbyists that don't want this to happen. So with cannabis, you could look at the timber industry not wanting to compete against hemp. You can look at big alcohol, big tobacco, big pharma as kind of not wanting to compete against cannabis. With the psychedelic industry, what's the equivalent? Is coffee lobbying against it because people can microdose and not drink coffee anymore? I mean, who is against psilocybin at this point?
I mean, I'll throw my 2 cents in there. It'll be the direct competitors of the products that aren't working for them. So for instance, depression, anxiety, PTSD issues, those types of mental health industries where the patients are treatment resistant. So instead of going to try these methods and then go to the last ditch effort, that may be a first ditch effort. And if that workflow happens, then those are the companies that'll be most effective. I'm not going to throw any names out there, but we can all make a guess on that.
Yeah, and I think you don't want the pharmaceutical companies, they don't necessarily want to shoot themselves in the foot either. So there's the potential that they may gobble up a lot of these companies and then just shut them down too, because they've already prioritized and spent billions of dollars on their other drugs. And I think that's a valid concern, both for this industry and for the cannabis industry is, there's already billions of dollars being spent on the market on these other drugs, and how do we keep this from becoming the next number one?
Yeah, Sarah, I would agree with you, but there's a certain point where I believe that I'm just going to speak out a little bit with the types of companies that I mentioned. I don't know if they would allow that to happen. So in this industry, what's more important, helping people or money? And I feel like the people at the helms of those ships wouldn't sell out. And I hope I'm right, but the feeling is different in this industry, I believe, than before.
That's interesting. Yeah, I don't think people were gonna say no to money, but that's my personal opinion. I guess we're gonna have to wait and find out. Where can people find you at? Michael, where are you at? Where can if people want to get more information about you or Quantum 9, where are you at?
Yeah, quantum9.net is our website. We work in the psilocybin and cannabis space. We've done incredible work in the cannabis licensing space and regulatory spaces already, helping regulators understand cannabis and such. So quantum9.net, and I'm located here in Chicago.
Perfect. And then Sarah Chase, you're the executive director for the Council of Federal Cannabis Regulation. Where can people get a hold of you if they want to talk to you some more?
Yeah, you can email me. It's Sarah with an H at uscfcr.org. You can also go on our website, which is www.uscfcr.org. And you can find us on Twitter, Facebook, LinkedIn, but reach out and email me. Happy to talk to anybody at any time.
Awesome. We're going to take a quick break. We're going to come back with another panel. But with that, I want to thank Michael and Sarah. Both of you guys were awesome. Appreciate it. Thank you. Have a great weekend.
With that, we're going to roll this one up. I'm Josh Kincaid. This is The Talking Hedge. Don't forget to like, share, and subscribe, or don't, and I'm out.
Don't forget to smash that like button on your way out and check out these other videos that we've got.
99.9% of our DNA is identical. It's a 0.1% that truly makes us different and unique. And that's what the show is about. Find out that 0.1% about your favorite guests. Find out what music they like, their first cannabis experience, and even what their room looked like growing up. But more importantly, or as important, their journey. Learn what makes them unique on Everything is Personal.